If a couple is trying to conceive and has not after 1 year of normal and unprotected intercourse, then it means the couple should be investigated. In this video, we are going to learn one of the most common factors responsible for female infertility and how to minimize the risk. Female infertility can be caused by many factors, ranging from age, uterine, and cervical factors, among others. Of these many factors, one of the most common accounting for 30% of female infertility is tubal factor infertility. This type of infertility occurs when your fallopian tubes are damaged or blocked, preventing sperm from reaching the egg. The first cause of blockage is as a result of sexually transmitted infection, like chlamydia and gonorrhea. Infection can ascend from the vagina through the cervix, to the upper genital tract, the endometrium, and ultimately to the fallopian tubes, clinically presenting as pelvic inflammatory disease. Pelvic inflammatory disease is the second cause of tubal factor infertility. It occurs when bacteria infection affects the female reproductive system. If left untreated, it can cause permanent damage. It can lead to scar tissue and abscesses in the reproductive tract, making it difficult for eggs to pass through the fallopian tubes. It's important to note that signs of this disease can be mild, and as a result, you might not realize until you have trouble getting pregnant or develop chronic pelvic pain. If signs and symptoms are present, the main ones include painful urination, pain during sex, irregular bleeding or spotting, vaginal discharge that is yellow or green or has unusual odor. The last common cause of tubal factor infertility is endometriosis. This is a disease which tissue similar to the lining of the uterus grows outside the uterus. It causes infertility by forming a scar tissue which can block the tubes or prevent eggs from being released from the ovaries. It can also form swollen tissue. During menstruation, these abnormal tissue swells and bleeds into areas it should not, which can block the fallopian tubes. Or, it can simply damage sperm or fertilized egg before implanting on the uterus. How do we minimize the risk of tubal factor infertility? Ensure your sexual partners are tested for sexually transmitted infections. Get regular screening, especially if you have multiple sex partners. Also, use protection during sex. Lastly, be quick to seek medical help if you experience abnormal changes in your reproductive areas. Health awareness allows you to identify potential risk early, adopt healthier behaviors, and seek medical advice when needed.